Your home treatment for shoulder pain. Okay, what we're going to do in the next series of pages is review the specific treatment approach and exercises you should be doing to get relief for your shoulder pain. Obviously, this is why you purchased this book, and it's the most important section of this book. I do want to highlight a few important points. What I want you to firstly understand is that you need to clear these exercises with your physician or physical therapist. Make sure that you understand what kind of diagnosis you're dealing with, and based on that you can go forward. It is critical that you understand the two phases when it comes to reducing shoulder pain, and this is pretty much the same approach we use for treating different pain conditions in your body. The first phase is to stop inflammation and pain. The second phase will be to improve your posture, start regaining lost range of motion in your shoulder joint, improve rotator cuff strength and stability, and regain lost muscle balance. Ultimately, you will have improved posture, your shoulder will be stronger, your rotator cuff will do its job by stabilizing your humerus head in the shoulder socket, and you should hopefully be feeling pain relief. How soon can you expect results? Unfortunately, I cannot give you the exact answer, and if I tried, I would be lying. Each shoulder condition depends on the amount of time that you've been dealing with shoulder pain, the severity of your injury, as well as if there's been changes in your shoulder joint. Changes such as arthritis, scar tissue buildup in the joint space, as well as tendinopathy, that's spelled Tendinopathy, of your rotator cuff tendon. Tendinopathy is a condition which occurs over time if a rotator cuff is not healed and it is recurringly injured, thus causing the tendon to become weak and ultimately rupture. So, how often should you be doing these exercises? My recommendation will be to start off with 2 to 3 times a day, and I would recommend 10 to 20 repetitions. This is just a base guideline. What you should and could do is to base it on your symptoms. So each exercise stand on its own. Your goal is to complete the exercise without feeling pain. So if you are doing a specific movement and you feel that it's starting to hurt or aggravate your shoulder, you should stop immediately. However, if you've done 10 to 20 repetitions and you feel you can do more, I would suggest that you do a couple sets. So if you do 20 repetitions on, for example, standing external rotations with a TheraBand, you can increase your repetitions by doing 30, or you can do 2 or 3 sets of 20 until you feel a nice fatigue in your shoulder. Each week you should incrementally be increasing the amount of repetitions by 5 to 10 repetitions. You probably should not do more than 40 to 50 repetitions per exercise, and I would suggest that you break it up in doing 2 to 3 sets of 10 to 15 repetitions. Use this just as a guideline, but your goal is to improve your range of motion and improve your strength in your shoulder joint. So the first phase in your shoulder is to stop the inflammation and pain. If you've just injured your shoulder, it is critical that you seek advice from a medical professional and that they prescribe you the necessary medicine or apply the necessary injection to the shoulder to minimize inflammation and pain as needed. You also want to be icing aggressively to your shoulder to improve the healing in your shoulder and ending the inflammation. Inflammation and swelling is what ultimately forms scar tissue and will long-term weaken your rotator cuff. If you've been dealing a long time with recurring shoulder pain, which comes and goes, and lately just seems to be a chronic event in your life, what you should be doing is probably going straight into the range of motion and strength and postural exercises, since you're not dealing with acute inflammation. The second phase, as stated, is to improve your posture, your rotator cuff strength, and improve the flexibility and muscle balance around your shoulder joint. Let's look at the specific exercises. Exercise number 1, cervical rotation and side flexion while holding on to the table.